Hello, hello. Welcome back to another Is Google Right or Wrong show. Today we're busting myths or confirming what Google has to say about joint pain for women over 40. So stay tuned. We got a great show coming up. If you're not sure who I am, my name is Drew Tadia, founder and CEO of True Form Life. For the past 20 years, we've been working with women 40 plus to help them increase energy, burn body fat, and balance hormones. So if that's you, you are certainly in the right place. And this is a big topic. It comes up quite a bit. So I thought, why not see what Google has to say? And we will either bust some myths or we will confirm what the almighty Google has to say. Let me... Awesome. Just confirming we are in the right place. This is a live recorded show, or live recorded. I am recording live on our personal Facebook page. So facebook.com/trueformlife. I'm doing these every Tuesday morning live, 7:30 a.m. So you could be listening as a replay anywhere on a podcast, on our YouTube channel. Either way, regardless of where you're at, where you're listening, appreciate you jumping in to check out these details. I'll try to keep these ones a bit shorter than my usual Friday morning live shows. So what I'm doing is Googling. I think a lot of times we just Google, and we think that if you Google something one time, that's going to give you the answer or the right answer. But I think that's false, in my opinion. And I also think we often Google to until we find the answer we're looking for, and then that's gospel. So let's go through some suggestions here, and then I'll give you my opinion. So we jump in here to I just wrote exactly this: how to reduce joint pain for women 40 plus. To reduce joint pain, you can apply heat or cold packs to affected areas, do gentle exercises like walking or swimming, maintain a healthy weight, taking an over-the-counter pain medication like ibuprofen or acetaminophen, practicing good posture. I am not agreeing or disagreeing with any of these right now. I'm just reading what the top search is. This is actually Google's AI. It looks like they're incorporating rich foods and omega-3 fatty acids like fish into your diet. Okay, that gives us a baseline. Generalization, which is good. We have a generalization. We have something to work through. Let's see what else we have here. Okay. Is this from the Cleveland Clinic? clevelandclinic.org. Joint pain treatments includes simple at-home recipes. Your healthcare provider may be able to recommend applying a heat pad or ice onto the affected area for short periods of time, several times a day. Okay, well, let's jump into this one because it looks like it's come up a few times. I think hot cold therapy is fantastic. I'm not sure it's going to get to the root of the issue. This right here is more of a treatment than a prevention, which is fine. So just to be clear, this is a treatment here that's talking about hot cold therapy, which has been used for a long time. So what we're trying to do is flush out joint pain in particular is more difficult than pain in your muscles, for example. I'll give you an example. Like when you're going to a workout, you build up lactic acid, and that's what causes you to be sore the next day. So that needs to be flushed out. So there's a number of different ways to do that, from light cardio. That could be light cardio could be walking, jogging. It could be on a treadmill, elliptical, recumbent bike, etc. That's a good way to flush out lactic acid. So this one here, it's a bit more challenging to flush out lactic acid, but still, we want blood to go to the area, and then rush to the area and then flood out. So, good morning, Deb. There's a couple different levels here, I guess is what I'm saying, but heating usually always warms the area, right? So when you ice, after the blood is actually leaving the area, and then after you take it off, blood is flooding the area. So it's a little bit different. Heating is immediately flooding the area. Icing reduces inflammation, and then I wouldn't say that heating increases inflammation, but it doesn't necessarily reduce the inflammation as cold would. So all you're doing is creating blood flow in and around that area from hot and cold therapy. When I had, like for me personally, when I was going through back issues, I would hot bath as often as possible, and I would cold shower. So I'd also hot sauna to increase blood flow and heat to the area, and then I would ice to reduce inflammation. So I think if you have a nice combination, the problem is that it's the same thing when I played professional sports. It was I would sit in our hotel rooms. We basically lived in hotel rooms traveling on the road, and I would sit with ice packs on my hamstrings and quads. That was just a regular thing. I did that more for prevention, but definitely if you have injuries, you have to do that. But this is kind of similar. The problem is that I don't really see too many people sitting there with ice packs on their knees. You know what I mean? Like, so not only does the information or advice have to be useful, it has to be functional. And maybe I'm wrong. I just have a hard time believing a lot of people are going to sit there with ice pads on their joints, wherever that may be. But it's definitely worth experimenting and worth trying and worth adding into your regular healing regimen. Good morning, Mom. So like I said, the easiest thing for me to relate to is my own personal experience, and I spent a lot of time in recovery. And for you to get better with whatever that is that you're dealing with, it could be knee pain, hip pain, lower back pain. These are the main areas that we see women 40 plus come to us about. It's really what you're willing to sacrifice in time to make that happen. Okay, here's another one from MSD Manuals. Don't know why they pop up, but why does my full body have joint pain? Acute pain is in multiple joints is often due to inflammation, gout, or the beginning of a flare-up of a chronic joint disorder. So you could look at something like fibromyalgia, and this is basically your body's in a constant state of inflammation. So I suppose any type of pain, we were talking about joint pain here in particular, but that's an inflamed joint. What you need to do, in my opinion, is reduce the inflammation in your body. How you can do that, I would say, I'm a big fan of ice baths. But given our audience, a lot of women in this age group won't even consider having an ice bath to reduce the inflammation. Although we do have one of our MAT members that has been enjoying some ice baths, which is pretty cool in my opinion. But that is a great way to reduce inflammation. We can move that to food in particular. I'm a big fan of food. Food heals, food cures, food prevents, in my opinion. And if you look at foods that are inflammatory, like rancid oils, refined sugar, processed food, those are all going to cause more pain in your body. And then putting better quality foods in your body from antioxidants. Most people miss veggies. We have our spirulina and chlorella. Those are fantastic for antioxidants. Those are going to reduce the inflammation in your body. As anti-inflammatory types of foods, we have a really nice green detoxing soup, salads. Those are all really nice. Isn't it funny? Like if you look at an overgeneralization of people that just have steak and, like, let's say steak and potatoes as an overgeneralization, I would say that would be more inflammatory than anti-inflammatory. So if you want to make changes, looking at your diet particularly is a really good start. How to decrease joint pain naturally. Okay, move your body. Number 1, apply heat. Apply cold, stretch, fibrous foods, turmeric. Improve your sleep habits and get a massage. Okay, well, let's dive into these a bit. Move your body. I think that is absolutely incredible, to move your body. A lot of times when we're in pain, we want to move less. And I'll tell you firsthand, when I went through extreme back pain, I didn't move because I didn't know if I was going to make it worse. And I was like in so much pain. I couldn't imagine any more pain. So I was like, don't move. And I'll tell you, I was in such a bad state. I couldn't get out of bed. And I had a friend bring over a walker. That's how bad I was. So I could get out of bed and walk to the bathroom. And that's what I went through. And everyone went through their own. I'm certainly not a victim. I just share that with you because I have experience with chronic pain, and I was able to had zero pain, any pain most of my life, as a high performing athlete, professional athlete. And then I went through a 2-year phase where I was in excruciating pain, and I could hardly walk. And then I got out of that pain without medication, or I dabbled with medication, which was a terrible experience. So no medication, zero pain right now. And so I can speak on going through that and offering suggestions on how I did that and how that's helped other of our members or our one-on-one clients make better choices and make better decisions. But one of the things is that I was feeling much better, and I kind of I don't like to say throw your back out, but I guess I kind of threw my back out again, and I was in really bad pain, and I thought I wasn't going to be able to get out of bed again. And I knew I couldn't lay there anymore. I said, I have to get up and get moving. So I pulled myself out of bed with the walker and started moving. And then that little mini phase was very short because I moved. So I think that this number one here for a reason is you have to move your body. Otherwise, that pain is just going to get worse, and you're going to be able to move less, and you're going to be in a world of hurt like I was. So I would definitely suggest moving your body, even if you have joint pain. Dana says, living in Alberta is enough of an ice bath for me. I'm sticking to anti-inflammatory. See, thanks for sharing that. That's what I'm talking about, is like a lot of times people like just immediately ice bath. It's like a hard no without even consideration. But to me, like, the trade-off is so valuable. You could sit in an ice bath for 30 seconds to 3 minutes and you would have unlimited health benefits. But so many people are like immediate no, not even going to consider it. And I'm okay with that. It's just a suggestion. I particularly enjoy the ice bath. I like the ice bath more for the mental challenge, because it seems like it doesn't matter how many times you have an ice bath, it's still challenging to get into it. So, and then when you get out, you feel like there's no other feeling. You feel like a brand new person. It's like you're stepping into someone else's body that has zero pain and zero discomfort. But I can definitely understand most people aren't gonna do that. Number 3, I already talked about cold compressions. That's fine. Stretching. I think in general, like so stretching, being mobile, flexible, it's such a great idea. The more mobile you are, the less pain you'll have. That's just all there is to it. Like, just think about, the less you move, the shorter your muscles are, the shorter your joints are. Like, they tighten up, right? So I think about I'm a big fan of The Wizard of Oz. I think about the Tin Man, and he hasn't moved for years. And then Dorothy comes along and she puts oil on his joints and starts moving them around. And then once they start moving them around, they can move even more, right? And then of course he's walking and skipping down the yellow brick road. But like stretching on a regular basis to reduce joint pain, I think is a valid point, and I would consider that an accurate form of advice. Many people won't sit there and stretch, and they won't put in the work that it takes to have less pain. That's just the hard reality of it. We try to frame our members' minds differently. Like, we think differently, we act differently, we behave differently, which is why we get different results. And again, unfortunately, the vast majority of the world, like, we have so many, like, instead of, and everyone's in a different position. I don't have any judgment. I'm just saying there's many different areas of healing, I suppose, and looking at your food intake and activity intake, and whether you're on medication or not medication, or surgery or not surgery. There's a lot of different options and avenues, but I don't think one option is a one size fits all. And like, I don't think surgery is going to change your life. I don't think one plate of broccoli is going to make a difference. or one stretching session. I think it's got to be continual lifestyle habits and continuing to work towards better health on a regular basis. Think about the opposite. Like this world that we live in, it's not set up to be abundant. It really is. I mean, it depends on your mindset. But if you like, slightly different topic, but I do think finances and health are very closely related. But banks, credit cards spend more than professional football teams on marketing. There's a reason for that, to keep people in debt and paying 20%, right? Like we're not set up financially. Like the banks wouldn't be around if they didn't take your money and lend it out to someone else at 20%. Like, right? It's the same thing when it comes to your health. Like there's fast food and drive-throughs, and now you don't even have to, skip the dishes? You don't even have to get, and then you have Instacart, get your groceries, right? And I'm a proponent of some of these to save time, without question. I'm just saying that our society isn't set up to be mobile and move your body. It's like you sit on your couch and you open an app on your TV or phone and you watch. You know what I mean? Like you don't get up and you don't go to the store and rent a movie anymore. A lot of people don't get up and go to a restaurant or get their groceries. It lands at their door. Like my point is that we're not set up for success when it comes to health or finances. Like we have to work hard at it every single day. And the opposite of not working hard at continually making better choices for yourself and offering things like reducing joint pain is contributing to like moving less, I would say would contribute to joint pain. Masking with only medication, I would say would be contributing. Not to say you shouldn't take it. I'm not a doctor. It's not my role. I'm just saying that there's other options that you could consider adding to or supplementing with and improving as a whole, so you can find relief. Let's see. We got a comment here that says swimming laps. We need a master's swim club in Olds. I think you should start that. But swimming is a fantastic way. It's great for recovery. It's great for healing. It's also great for joints in particular. So great tip there. And then I believe you got to get your mind right first. Then people will do what is required, be that stretching, healthier eating, etc. Yeah. It's a tough one. It's chicken or the egg, right? I appreciate your comment, Dana. I'm not exactly sure if it's your mind first, because sometimes we see people that'll come into our program and they don't really have the right mindset because they've never had mindset training. And then we get them into our groups and we help them. First of all, we help them see results. That's one of the first things that we do. We help our clients see results within the first 10 days. And then they're like, oh my gosh, I never knew I could see results. I haven't seen any results in 20, 30 years. And then we get them into our group coaching calls and we start to celebrate wins and positivity. And then we have one-on-one calls of education and direction, and then I can slowly start to see their minds change and their words change and their vision changes. So it's a pretty cool experience to see. But I'm not sure if it's always mind first, but I 100% agree with you with what's required from being healthier in general. Anyways, I am hanging out here much longer than I thought. Let me read one more before. This one says, which vitamins are good for joint pain? D and K. Important for bone strength. K is involved with cartilage structure. I'm a big fan of D and K together. You know what's interesting is they often forget magnesium. I think D, K, and magnesium should always be used in the same sentence. So if your body absorbs D once you have high enough magnesium stores in your body. So you got to have magnesium with the D, and then you have to have K with the D, because the K is the driver, and it prevents calcification and making sure that the D is going to the right places. So that's a very good suggestion in my opinion, not just for bone health, but for immune system and There's a lot of different areas here that D, K, and magnesium would be. There's another one. What vitamin am I lacking for joints? Just says D. So we're lacking some information there. And then what's the strongest natural anti-inflammatory? There's a lot here. I'm not going to get into all these. Omegas, curcumin, zinc, green tea. How do I stop all my joints from hurting? Keep moving, ice. Use pain relievers wisely. Okay, I want to wrap things up. That's probably enough from me. Any questions at all that I can help with, feel free to ask. You can ask in the comments below or shoot over a DM. We're always happy to work with, answer questions or see if we can help in any way. Have a great day, everyone.